Throughout this past year, we probably all spent more time in our homes inside those four walls, and for some, that can cause a variety of mental health issues. Today, we have Harmony Gould from Pine Rest as part of our virtual home show. And of course, we're talking, literally, we are at home a lot in the last year. And what have you been able to see? Because my understanding is that the need for services is at an all-time high.
Yes, the need for behavioral health, mental health services has been unprecedented in this last year. As we see people impacted by isolation and the pandemic, they have really decided, I need help because of the stress that they're experiencing. So we have had a very high demand for the services we provide at Pine Rest.
Yeah, Pine Rest has been a trusted and known name in the community for a very long time, but you don't have one solution for everyone. Everyone is very different, and you offer a lot of different services that I feel people are probably not aware of.
Right, so that's one of the things we find when people come to visit our campus at 6th Street and Division, is they are surprised by how large it is.
Sure.
And the breadth of services that we provide, whether it's outpatient, in-person, or a telehealth option, or our psychiatric urgent care, or intensive outpatient, or partial hospitalization. The list just keeps going.
Yeah, what would you offer somebody who might be struggling during this time? And that could be someone that's saying, I don't know if I need help because, there's just, I'm having these little feelings, or people who are outright really having a hard time with it.
One of the ways we help people try to assess themselves is thinking through, has something really changed for you? Are you overwhelmed by feelings of anxiety or panic or hopelessness? And if that's true, or if you find it really difficult to do things that you used to not have any problem doing, it might be time to reach out. And one of the nice things about the clinical team at Pine Rest is they can assess and evaluate what's right for you. So as you mentioned, it's not a one-size-fits-all. So as someone would come in and be assessed, that clinician can really help guide them to say, you know what, I think an outpatient visit, therapy, will be the right service for you right now. So our focus is finding the right service at the right time for the person.
How do we best take care of ourselves during a time like this, where there is a lot of uncertainty and that we are experiencing some really big changes that we may be uncomfortable with?
Well, self-care is incredibly important. And so we talk a lot about being physically distanced, but we don't want to be socially distanced. So use the tools that we have. Reach out to friends using the phone, a video chat, text message, group chats. Stay connected to people socially. So if you're having a bad day, reach out to a loved one and check in, or just check on someone that you care about, and maybe that interaction will help you. It's an opportunity to ask them, what strategies are you using to cope? Get sleep, get exercise, get outside. Those are all really good ways to take care of yourself.
And Pine Rest is available virtually. That might be a good option for somebody who is just seeking to reach out and maybe get some help or see if that's needed.
Absolutely. Many of our services are offered in person or virtually.
And I want to ask you about psychiatric urgent care. Again, kind of going back to the campus and not really realizing what may be available. You opened your psychiatric urgent care in April of 2019. And why was that so needed, Harmony?
We find that some people need care now, and there can be long waits when you reach out for an assessment or an evaluation. So we wanted to create a space where if you decided, I need help today, that you could walk in, or you could make the call and say, I'd like a virtual visit. And so that is what psychiatric urgent care does for people. It's quick access. There's a clinical team, including a psychiatric provider, that can evaluate and assess and then help develop a treatment plan specifically for you.
We've been seeing some images right here, and this is very different from what people may have in mind of what Pine Rest can look like. There are a lot of stigmas, we know, with mental health, and even a facility where someone would go to get some help. And this is really bright, really cheery, very open. It almost seems like a living room.
We want to welcome people in. We don't want to be intimidating.
Yeah.
We understand that it can be really difficult to take that first step and look for help. So our hope is when you walk through the door, it's not intimidating or scary. It's warm. There's a nice fireplace in that waiting area. So we really intend for it to be a safe space for people looking for help.
You know, I think we've come a long way, but we know that there are a lot of stigmas that still exist. And personally, how do you feel about that and overcoming some of those stigmas, or do you feel like we've been doing a good job in the way that we're able to talk about mental health now? And we've come away, because I know you've been with Pine Rest for a long time.
We've definitely moved forward, but we have a long way to go. And we want people to not feel any shame when they need help. The prevalence of anxiety, depression, or substance use disorders is quite high.
Right.
But we won't make much progress if we don't help people see that there is a path forward, there is hope, and you can get the help you need.
Yeah. Okay, so we have a bunch of contacts. We're going to put them online so they're easy for people to get to reach out. As you mentioned, there are a number of ways to get that evaluation. You have your psychiatric urgent care if somebody is in real need to even same day go in. You know, parting in this, what is your message to people? What is the biggest thing that you want people to know, Harmony?
If you have a question, if you think you might need help, just call. And we will help get you to the right service at the right time. You don't have to suffer in silence. You can get help from professionals who it's their calling to do this. So reach out and we'll reach back.
And know that you are not alone. So impressive in your psychiatric urgent care. 6,000 visits in the first year, and that need is increasing. So thank you for the work that you're doing. We appreciate it.